Hello and welcome to Healthy Living. I'm your host, Regina Price. I'm now joined with Dr. Pa Kofi Obeng, who is the internal medicine physician at Bon Secours. Thank you so much for joining me today.
Thank you for having me. I appreciate it, Regina.
All right, and today we're going to talk about asthma, and as I understand, it's a chronic disease. Can you discuss a little bit about what exactly it is and some of its symptoms?
Sure. Asthma is a chronic disease. It's a disease of the lungs, of inflammation of the lungs, of the airways, so you can't breathe appropriately. It's one of those lung diseases that is reversible with medication, and it tends to develop usually when you're young, and it also can progress when you're older. And again, it's typically triggered by some sort of allergic component as well, but other things can trigger it as well.
Okay, what would some of those triggers be?
Sure. It's a very good question, Regina. Some of the triggers can be pollen, dust, mites, things like that. Also to exposures, work exposures such as noxious fumes. Let's say you work in a factory, those types of things can trigger it. Mites, all those types of things can also trigger an asthma attack.
Okay, and what are some causes of asthma? I was reading that some could be hereditary, some are more environmental, kind of what you were elaborating on.
That's a very good question, Regina. Typically, asthma, there's no one cause. It seems to be multifactorial. There seems to be a genetic component. There's not one gene. Like the asthma gene, there's a combination of things that can predispose someone to developing asthma. There are certain environmental exposures to where they live as well can develop it. People who tend to live in urbanized areas seem to be more affected than people who live more in rural type areas. So.
Okay.
Yeah.
All right. Who can be affected by asthma?
Sure, anyone can be affected by asthma. Again, typically it occurs it can develop in younger children, also can affect older people as well. It's across all age ranges, but in terms of people who are at increased risk, tends to be people who have, unfortunately, minority populations tend to be at higher risk of developing asthma versus non-minorities. People who need to use medications more often tend to be at risk as well. But anyone can be affected by asthma. There's just certain populations that you have to be very cognizant about.
Okay, and is this something that, if maybe you had it as a child, then it could go away, or vice versa, where you didn't have it and then you can develop it as an adult?
Yeah, in fact, we had a person here previously mention that he wasn't affected as a young man, and then as he got older, he developed asthma. Asthma, you don't necessarily outgrow asthma. Your effects can be more reduced. I wouldn't recommend people just stopping their medications. Let's say they had it when they were young and they feel better, now they're a teenager. I'd still recommend that you'd have at least your rescue inhaler on hand. But again, it is a chronic lifetime thing that you have to be aware of and cognizant about.
Okay, and kind of you alluded to your rescue inhaler and things like that. What are some preventive measures that people can take to kind of control their asthma or maintain?
Follow your doctor's advice. No, but definitely in terms of staying away from the triggers, that's one of the main important things you can do. Making sure that you have areas that are free from dust, whether it be using like a HEPA filtered, like vacuum cleaners, things like that, hypoallergenic items, hypoallergenic carpets, things like that. Making sure that you don't smoke. That's another thing too. That can be another trigger as well. And then also using if you're already on medication, using your maintenance inhalers. That will decrease your exacerbations if you adhere to them. So.
Okay, and if someone is experiencing some of the symptoms that we talked about, actually, could you mention some of those symptoms? The wheezing?
Yeah, the wheezing, cough, congestion, a lot of mucus productions associated with it as well.
Okay.
In terms of symptomatology for an asthma attack.
Okay, and if they are experiencing some of those, what is the diagnosis process? They are having these problems, and they come, to see you. How would that whole process go through?
Okay, so if they come to see me, the main thing will be, again, you present clinically, you're having cough, you're having this congestion, you have allergies as well. That kind of sets off a light in my head that maybe this could be asthma. Next step would be doing what's called spirometry. It's not 100%, but in combination with your symptoms and the findings we see on spirometry, that can get us to the diagnosis. So that would be the next thing, and then next thing after that would be something called a bronchial challenge test,
Okay.
based on that. But it all depends on your symptomatology, how you present initially, and then doing spirometry gives us some idea too. And when you do spirometry, that you also want to see if the person's obstruction, because it is primarily obstructive process, if it reverses with a medication that opens up the airway.
Okay. And can we go back to some of the different types of medication that could be used based off of what stages they may be in with asthma?
Okay, yeah, that's a very good question. So we typically categorize them as intermittent and persistent, and then under the subcategory of persistent is mild, moderate, and severe. So based on if they're intermittent, usually their symptoms are less than 2 times a week, having nighttime symptoms less than 2 times per month, and so forth. And also not using their inhaler more than 2 times per week, their rescue inhaler more than 2 times per week. And then people who are persistent, they tend to have more frequent symptoms of their asthma attacks. So the people who are lower risk, like your intermittent people, typically like your albuterol would be an example medication that you'd use. People who are a little bit worse off, who don't have as good control, they're having more symptoms, then you add on something like a Flovent, that type of thing, Qvar, or you can also add in, depending on their stage, things such as an Advair or Dulera, that type of medication.
Okay, and also I was learning during your presentation that asthma can actually lead to some other illnesses or diseases. What can it lead to?
Asthma can predispose you to certain conditions. I mean, you're more susceptible to develop pneumonia, flu, things like that, because your airway is already compromised. If you look at it, someone who has an intact airway, they'll get affected, but not to the extent of someone who has asthma. Same thing with people who are long-term smokers who have COPD. They tend to be prone to get more frequent lung infections like pneumonia, flu, and so forth.
Okay.
So.
Okay, and can you talk a little bit about some advancements? I understand asthma has been documented for hundreds of years, even thousands of years. So just advancements, in the 21st century that, you kind of put people at ease that, okay, I have this condition, but there's help out.
Yeah, there's hope. No, there's a couple things going on here. Our mainstays are your albuterols, your short-acting beta agonists, and also your your stronger inhaled corticosteroids. And then a lot of times today we're using a lot of combination medications like your Advairs, Symbicort, things like that, which are both the steroid portion and the beta agonist portion, which are some of the things that we commonly use. There's also medications that are in a different class, but still help to open up the airways. Things such as Atrovent, things such as Singulair is also another drug. It's a different class of drug, but it also is very helpful too. It's been around. And things such as Xolair, which is for people who have worsening allergen-related asthma. That is an injectable medication that you get every 2 to 4 weeks, roughly.
Okay.
So those are some of the options. Then there's immune therapy, but that's not used so often. That's more so in the extreme stage where the person hasn't been controlled and you have no other recourse. So.
Okay, and I'll have a few more minutes before we close out. Let's say someone they have the symptoms, they've gone through the diagnosis, they've actually received the treatment. How important is that follow-up, with the patient?
Yeah, that's a very good question, Regina. The follow-up is very important. It helps us know where you are in terms of your asthma management. If you're under well control, if you're under sort of intermediate control, or if you're under poor control. That follow-up is important in terms of adjusting your medications or making some lifestyle changes, environmental changes, and so forth. So it's imperative that people come in. I was previously speaking on the follow-up. When we first start you out, when we find out you have asthma, we first start treating you, we see more frequently. We'll see you every few weeks. Then once you get under better control, we might see you every couple of months. And then once you're at very good control, then we'll have you back maybe in a few months to see if maybe what we have you on currently could be scaled back, or if we can keep you there. So it all depends on the patient. But initially, we like to see patients and follow up every few weeks when they first start out, and then we stretch it out a little bit longer.
Okay, so they really do need to do what the doctor says.
Yeah, please, yeah. We don't know it all, but we've been trained to deal with this, so.
Oh, and if you could leave us, Dr. Obeng, with your contact information or any websites that viewers might have, more questions and they want to seek you out.
Sure. Sure. I'm located at Nanceman Family Practices off of Bridge Road. It's 2897 Bridge Road in Suffolk, Virginia. They can go online to the Bon Secours website and even just Google it as well. Some helpful websites that at least I found in terms of researching asthma would be the CDC has a very good website as well in terms of how asthma affects the general population. The National Heart, Lung, and Blood Institute, that's under the National Institutes of Health. That's also a very good site for people who have questions about asthma because their purview is dealing with lung issues, COPD, asthma. Those are two very good websites to go to. So.
Okay. Well, Dr. Obeng, thank you so much for your time and your wealth of information.
You're very welcome.
And we'd like to say thank you for watching, and here's to your health.